I'd like to call the TCHC Public Board meeting to order, and I would like to say welcome. My name's Adele Imrie, and I'm the chair of the TCHC Board of Directors. Today's meeting is a hybrid meeting. We do have some members who are on attending virtually, but as I said, I really appreciate the number of people who have made the effort to come here in person. I do think the engagement is much better. So I would like to begin with an acknowledgement that the lands we are on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And it is home to many diverse First Nations, Inuit, and Métis peoples. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We also acknowledge all treaty people, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. I wanted to acknowledge that this is Tom Hunter's first public board meeting, and I wanted to welcome him as our interim president and CEO of TCHC. I have to say, when this was in my notes, that I actually didn't believe that this was Tom's first public board meeting, because it seems like he's been here forever. So I'm sure he thinks he's been here forever. But anyway, I did confirm that this is his first public board meeting, and I want to thank Tom. He's been here since August, and I can't speak highly enough of the contribution that you're making to TCHC, and I really appreciate you filling in this role as we're looking for a new CEO. I would also like to welcome Councillor Perusa. This is also his first public board meeting, and he has been working with us very closely behind the scenes and at our in-camera meetings, and I really appreciate his contribution. So thank you very much. There's always a lot of work happening at TCHC, and as the board chair, I get to appreciate that firsthand. And I know how hard staff and management work on some key initiatives, but also just in general. And I have to say, on Wednesday, I had the honor of taking a CSU tour of the West region. And I started at 495 Wilson, which is a Category 1 building, and it's the regional head office for the West. And then I went to 2195 Jane Street and the Thistletown Townhouse Complex, which are both Category 4 buildings. And actually, the West region has more Category 4 buildings than any of the other regions. I understand that there were some pictures that floated around of me in my protective vest as I went on this, as I went on this tour. But I was able to sit down with Liqua, the general manager for the West region, and his incredible staff. And it was a very eye-opening afternoon for me as I saw what TCHC staff are dealing with on a daily basis at our properties. But I learned so much on Wednesday. The staff had very thoughtful and constructive comments on how TCHC could improve, and I will certainly be sharing those comments with Nadia and Tom, as they were really insightful. I was really impressed with staff's commitment and dedication to TCHC, but most importantly, their commitment and compassion to staff, or to tenants. I would like to offer my sincere thanks to Liqua, Zainab, Al, and Greg, who took me around for the full afternoon, and as well as Mathia, Gary, Dan, Leanne, Dan, Marlon, Joe, and Amy. I really appreciated their time and their valuable insight, and TCHC is fortunate to have staff with their passion and expertise, and I was inspired by all of them. And as a board member and as a board, I think that we should take every opportunity to celebrate our frontline staff. This is really where the real work gets done, and we need to listen to them as we try to listen to our tenants. So I learned that the West is the best on Wednesday, but I'm also looking forward to visiting the other two regions as well. And I think it's very important if you ever get the opportunity. I would like to also highlight management's work as it relates to the Ombudsman's recommendations. They have been working on implementing the recommendations that the Ombudsman included in his report on human rights complaints process. There is an interim policy that has been developed and will be available on the website in the coming weeks. The policy was developed with feedback from tenants and stakeholders in several engagement sessions earlier in the summer. And employee training on the policy and processes will be an important component of this work and is about to begin. The Ombudsman report was presented to Council on October the 12th, and I am grateful to our board councillors for their support of TCHC's effort in addressing the recommendations within this report. And we look forward to the Ombudsman coming to a future public meeting to present his report. And human rights are a top priority for TCHC, and we can expect to continue to see focus from the organization as they review the effectiveness of this interim policy and move forward with implementing the full recommendations included in the Ombudsman's report. I would also like to highlight the work that is being done on Mayor Chow's affordable housing targets. We've had, I was very pleased to participate in recent conversations with Mayor Chow and her staff and TCHC as TCHC moves to support the Mayor's ambitious affordable housing plan that was announced at the end of August. I think TCHC has an unparalleled experience and skills to enable the advancement of this work, and it's critical for the City of Toronto, and we are looking forward to working with the city and Create TO and other agencies as we all collaborate, because it's very important that we are aligned as we move forward in this initiative, and certainly TCHC is uniquely positioned to be part of the solution. And we were able to communicate that to the mayor, and we will be coming back with updates on that initiative in the coming meetings. The last highlight I wanted to speak to is just the United Way and the support that TCHC as an organization has for this important not-for-profit in the city. I did attend the barbecue, but there's been a number of other fundraising activities that have taken place since then. There's been a golf tournament, a 5K civic run, and last weekend a group of 10 employees, including our CEO, climbed the CN Tower, all 1,776 steps. And I would like to congratulate our CEO.
23 minutes and 12 seconds.
Yeah, on his time, 23 minutes and 12 seconds.
But who's counting?
Yeah, somebody amazingly did it in 11 minutes, which just shocks me. But anyway, I just wanted to say congratulations and thank you for your support for the United Way. So far, TCHC has raised $71,000, and they're hoping to exceed their last year's support of $90,000. So I wish them a lot of luck and thank them very much for their support. So I will be moving on to item number 2. And I would ask if there are any additions or deletions to the agenda as presented today. Yep.
Do we not have, is there an employee checkoff for United Way at TCHC?
Sorry, I missed that.
I don't know if there is. Just hearing that fundraising, is there employee checkoff at TCHC where you make, I don't know, somebody knows.
Payroll. You talking about
Payroll, yeah.
payroll withholding? Yeah, I don't.
Payroll deduction plan. Yes, there is a payroll deduction. Yes.
Okay, thank you.
Sorry, I didn't.
So are there any additions or deletions to the agenda today? Okay, hearing none, can I ask if any members have any conflict of interest as it relates to the items on the agenda today? Okay, hearing none, I will note that we have 3 deputations today. So items 9A, 9B, and 11A are being held Are there any other items that board members would like to hold? 9A, 9B, and 11A. Those are the deputations.
9G, please.
9G, okay. Any others? I wanted to hold 9F as well. So could I ask for a motion to approve the agenda with the exclusion of 9A, B, F, and G, and 11A? John? And could I have a seconder? Joe? Thank you. All in favor? Thank you. Perfect. So we will move on to 9A. And, pardon? It wasn't held, so it's, yep, it's automatic when we approve the agenda, except for the items that are being held. So could I move on to 9A? And yes, and is it Miguel is the deputant? Welcome. So this is the 2024 corporate insurance renewal that you'd like to speak to.
That's correct.
Thank you.
Is the overhead working?
Someone from the city will help you.
Can you hold my time, please?
Yeah, we won't start it until you're
Okay,
set up.
thank you.
Thank you.
Hello, how you doing?
No worries.
I'm old school, so. I said, this is the best way I can, enlighten you about the issues that happen in the community, in the building, et cetera, et cetera.
Okay,
All right, so I think it's working now, maybe.
so you're speaking to the insurance?
Some buttons.
Yes, we do.
My God, when I started here, we still had the same machine since 2010, which is fantastic. It's a relic. Well, while this is being turned on, the flyer is from last week. We have a water service interruption and heat. And this is basically because the boilers. We also have another incident, the pipe burst on the 8th floor that affected up to 8 floors from the number 8 to the bottom. We're discussing the corporate insurance. So my feeling is that those tenants that have been affected by the burst pipe at 220 Oak Street will be compensated, I believe, through the tenant insurance. But this is the big surprise. Many of my residents, and that I will say the rest of residents of TCHC do not have tenant insurance coverage. And it's because we haven't been very persistent in addressing this concern. Every time members of my building or surrounding buildings of TCHC, they say, Miguel, I was expecting that my landlord will replenish my furniture, my TV, et cetera, but the fact of the matter is not true. So you had to get insurance in order to recover some of your needs, right? So you can start out from fresh again. So the page 2 of the report says, the HSC core program insurance coverage acquired through HSC, which includes commercial general liability, property, crime, boiler, and machinery, and directors and officers liability. I wonder if there's a section that covers all the human race settlements that are out there. Oh, by the way, I sent my deputation earlier to Sonia, so probably you guys have it. So we are currently also having a delay on this is from my last deputation at BFAC. I couldn't be in person, so I submit my comments. We are having a problem to address the renewable project. I wonder this will be resolved very quickly. I have good news. I got a chance to speak to the management of the tower renewal, and they said that this year they will be including new boilers for 220 Oak Street, so that will address the problem, hopefully, at 220 Oak down the road, but it won't happen immediately. I am requesting a review of the calculations so that way you can find extra money so we can have different railings. My residents have expressed concern that the railings are old-fashioned, going back to the 70s, and we want to be at par with the residents who live in Regent Park who have wonderful glass panels railings. The other part of my deputation is that I got a chance to attend the ONFA conference, which I missed listening to Olivia Chow, the opening remarks. And I mentioned that TCHC should include members of the community to attend ONFA because you learn a great deal of things, especially land trust, which is the hot item right now. And as you probably are aware, next week on executive committee, we'll be discussing an ambitious generational housing program by the mayor announced this past Wednesday. So the other thing I want to say is that I want to invite you, all of you, including Tom and the mayor, to attend the opening of our mural. This is the cooperation between tenants and artists who have developed this beautiful mural that will be you can view it from the Don Valley when you travel around the Don Valley Parkway, and it will be a positive element that will remove the stigma associated with residents living in TCHC, where the perception is that they are all bad people, which is not true. We are humans. We just happen to live in poverty, right? So this is a great opportunity to come and meet and mingle with the residents. I never see Tom Hunter coming to 220 Oak. Maybe there's a public invitation, Tom. Come to see us. Come to talk to us. And we will be glad to see you on Monday, October the 30th from 2 p.m. And to end my deputation, I still have one petition from residents, 35 residents from July the 5th. It hasn't been responded. I have a second petition from the residents from October the 23rd, and both have not been responded yet. So look forward for reply. And that concludes my deputation.
Thank you very much for coming.
I'm here 24 hours if you have any questions.
Okay, thank you very much. Are there any other questions or comments as it relates to 9A, the insurance renewal? Okay, hearing none.
I have a question.
Oh, you do have a question? Sorry, John.
The deputant made mention of damage done to units. Do we have coverage for, we must have contents insurance coverage?
So TCHC maintains insurance against a liability risk and as well for property. So the property, of course, that's insured by TCHC through its insurance is TCHC's property. That insurance wouldn't extend to tenant property. We encourage tenants to maintain their own tenant content insurance, and some years back we actually, through our communications team, undertook a fairly significant campaign to encourage tenants to take that step. Where we have issues in the buildings, or just by virtue of the fact that we own the property on which the buildings are situated, that can give rise to claims by tenants against TCHC, we respond to those claims pursuant to that insurance policy. So tenants may be able to, where we're at fault, seek recovery for their lost damage. We retain go through an adjustment process.
So if there's a flood upstairs and overflowing toilet or sink or what have you, and it damages a tenant's carpeting or something like that, or bedding, they can put, and they do not have insurance for that, they can put in a claim against us for recovery?
So if there's an overflowing sink, then there's going to be a question about whether that is an event for which TCHC is responsible, or if it's the person who left the faucet running that overflowed the sink.
Right, but if I'm on the 5th floor and this happens on the 6th floor, how do I get my carpeting or bedding or clothing, covered if it's no fault of my own and I do not have insurance?
The question that, I understand the concern. The question may be whether or not that's a responsibility that TCHC needs to and should assume. We have, a number, you can imagine, in our portfolio, we have a number of instances where the activities of one tenant may impact their neighbors. And,
Sure.
and absolutely, we deal with those claims from the impacted tenants. We have staff who will work with the tenants to resolve any claims that they may have, to the extent that we have responsibility.
So I would suspect that probably a small percentage of TCHC tenants actually have contents insurance. Do we know that?
Well,
It's for- the
HSC.
Questions, sorry?
HSC has said that only 1% of our tenants have content insurance through HSC. That doesn't mean that they don't have it other ways, but only 1% through HSC.
So if there's in another instance, if there's a fire in one unit and another unit is damaged and that person has no contents insurance, they're basically out of luck. Is that, with all of this coverage we have a lot of coverage that we talked about it at the last meeting. We don't have any coverage for an instance like that.
So I think our experience is that when we have fires in our buildings, regardless of the cause, that we work with the tenants in our buildings to try and address their needs. To the extent that we have insurance coverage that can afford some assistance to the tenants, we'll look at issues on a claim-by-claim basis, and where we have responsibility, we'll respond.
And if we don't have responsibility?
And where we don't have responsibility, we continue to work with tenants to the extent that we can to address their needs. And that may, in fact, in some circumstances, on a case-by-case basis, do so in a manner that is sympathetic to the position in which a tenant who, through no fault of their own, suffers that kind of loss. It maybe we take an approach that is sympathetic to that situation. But again, to the extent that we are managing those claims, what we're talking about is largely decisions that we're making in relation to how we apply our own internal resources. And we need to be cautious around how we use public funds in responding to those circumstances.
Brian?
Considering the challenges financial that many tenants have, could we look at what the cost would be for a basic level of coverage across the board? I don't know whether that be through HSC or even through some fund that we set up ourselves and internally sort of insure for tenants. But the likelihood of expecting tenants to have coverage, especially those that are on RGI, when it's a question of insurance or food, obviously, it's going to be a moot point for them what they are going to choose. So I just didn't know whether, whether there's some basic coverage that we could figure out a way of providing across the board. And look at that, the pros, the cons, the cost, those sort of things.
Anita's going to speak to that.
Thank you, Member Smith, for the question. Through the chair, as she mentioned before, there's the HSC program that's available to tenants. That is not the only insurance that's available to tenants. And we did some research to take a look to see if there were some possible subsidies that tenants can apply into as well. So there are some opportunities. So we're more than happy to have those discussions with our tenants if they want to reach out to us and have those conversations.
And
Thank you.
HSC said the same thing, that there was provincial assistance, but Brian?
Just knowing, sometimes wading through the maze of ways of getting this, I mean, could, that in itself could be a barrier for tenants themselves if you have to go here, there, and everywhere and figure it out, and there's enough challenges in people's lives to deal with some more even basic things. I just wondered, John, whether it would be appropriate for your committee to take a look at that with staff and try and figure out, is there a way to facilitate something with a not a huge cost to TCHC, but since it's
I think coverage for 50,000 units would be a huge cost.
Sorry, is it, in the leasing process, is it customary to ask for tenants to have tenant insurance as part of the leasing process? That's sort of my understanding generally. Is that the case with TCHC?
So through the chair, we do request it. It is also indicated and implicated on the lease.
Yeah, I don't think it's enforced.
so you know whether people have it or not, is that correct?
No, I believe it's a legal statute, and Derek can speak to this more than I could probably, around the lease that requires tenants to have it. Having said that, we recognize that a lot of our tenants do not have it. We have had discussions about bulk purchasing insurance, looking at costs, but I think where we landed, Dara, was we're not able to provide the insurance on behalf of the insured, I think was the distinction there. So even if we could fund it ourselves, we still would require individual tenants to sign on.
So without getting too legalistic, there's a concept that is insurable risk, that in order to secure insurance, you have to have what's described in law as an insurable risk. You have to have an interest in the property that you're trying to insure. So when it comes to tenant content insurance, TCHC doesn't own those assets, doesn't own that property, so we can't insure it. To the point that Ms. Sangstedt raised, though, we have identified through HSC that, for example, tenants who are on social assistance may be able to access funds that are available through social services to cover the cost of tenant insurance. And so that would necessitate discussions with Toronto Employment and Social Services about how we make sure the tenants in TCHC property who are in receipt of social service benefits understand that those funds are available to them and can draw on it. And that, again, given that those resources exist from another government body, that may be a strategy that we can encourage tenants to follow, so that we're not reinventing a program that already exists with funding available through another body.
Okay, so maybe if you do the research, you could go back to John's committee.
Have a supplementary here? No, I just wonder whether from a staff perspective, because sometimes it's difficult to wade your way through, so whether that could be something that is a specific responsibility for the appropriate staff to help the tenant sort of manage that process, because it's not always easy to
But I think some research has to be done before we even get to that stage. So Anita, it seems a natural connection that she would come to your committee. John? Okay, so we'll ask, I know Uba had her hand up a while ago. I don't know, Uba, if your question's been answered? And then Paula?
No, I was thinking if I can hold item 8, please.
Okay, we passed that, Uba. We've already voted on it.
I think that.
So we're going to talk about it later on, though.
I think that she wasn't present when we voted to approve the agenda.
We've already voted, Uba. So Paula, did you have a question?
Adele, you and I we had an extended, I'm not done, please. We had an extended discussion about this item.
Yes.
And if we're going to talk about later on, and I have, can say what I needed to say respectfully, I would appreciate it. If not, I don't think it's going to be the end of the world to hold that item.
I think she's just asking to reopen that item, that's all.
Okay.
Which you can do. a board
Yep.
member can ask to have
Okay,
it reopened.
so let's finish 9A first.
Yep.
And then we can go back to you, Uba.
Thank you. Many years ago, there was a conversation about HSC providing content insurance, but to me, this is one of these issues around insurance and what we do, et cetera, that probably should be, we should ask for tenants' thinking rather than staff, just staff. So looking at, I don't think everybody understands the depth of it if you get into a problem. So for me, that's a TAC issue, Tom, that would be how, we should get some thinking about that, how important it is, any options, what our issues are, why we can't do this, why we can't do other things. Because once you have a problem as a poor tenant, now you've got to triple that problem when you've lost everything or. Thank you.
Okay. Are there any other comments on 9A? Okay, hearing none, can I have a motion to approve corporate insurance renewal? John, thank you. Nick, seconder, all in favor?
Did we get that? We're forwarding that to the TAC for request, yes?
Yes.
That formally, I'm asking that. Thank you.
Okay, yes.
Thank you.
Okay, so we'll go back to item 8. Uba?
You have to reopen, Madam Chair.
So I have to reopen this? I don't know, how do I go about doing that? Can I move to reopen item number 8, which is the update on the tenant-led improvement in the basement spaces?
Right.
Nick, thank you. Naram, thank you. All in favor? Thank you. Okay, Uba.
Thank you very much. Thanks, Paula, and thanks, Adele. I know we talked about this in the TCHC meeting. A lot of, tenants come to us wanting to beautify, build a little bit, not built fully, but, improve their basement for safety reasons so they can keep their kids indoors. Others say they already did a little bit of work in terms of covering the ceiling, which is very dusty, and covering the washer and dryer and painting the unit. This item was, as I said, for a while on the table, and TCHC, I thank for the staff who work on, because working on this 4 times, it's a lot of work, and I appreciate that. But at the same time, I know the decision has been made, which I'm not fully happy about it, if I may be honest, because we need to respect the input of our tenants. We need to give them some autonomy while we also ensure the safety and making sure that we're not compromise liability and safety and all the things that we talked about. But they're asking bare minimum. So if we're saying we're a tenant-focused, tenant-centric organization, then we need to give some what do I say? Some control over the physical structure of the tenants' homes. This is truly unfortunate that we're saying they can't do this, they can't do that. I hope, in spite of this decision, management will find time to think through and develop a guidelines of manageable change that tenants can be able to do in the near future. This is an important issue for tenants and for me, and I think we owe them the respect to try and find ways to be more accommodating to their request. And as I said, if we truly saying that this is tenant-centric, again, I'm repeating myself, and tenant-focused, then our work should ensure that our tenants have the sense of ownership and belonging to their homes. A lot of people felt that they were not accommodated, and I personally felt that there was a lot of barriers rather than finding solutions, because if there is a will, there is a way. And again, I'm a board member. I'm not trying to compromise the integrity of the corporation or safety or insurance or liability. That's not what I'm saying here. And when these tenants, a lot of tenants came to me, I try to be the devil advocate and educate them and say, this is doable. This we need, we need to look into more. So right now, all they're saying is we're not even looking to build rooms. We're not looking to build big infrastructure. All we're looking is the bare minimum, which is just to close the ceilings. Again, it's a dusty reason. Close the dry and washer and have a space that feels at home. So our kids can do their homework. We can work from home if we want to. And the bigger piece is a safety issue. A lot of people say a lot of the crimes that do happen in TCHC property, unfortunately. So parents are really saying that we prefer to keep our kids and our youth indoors in basements where we can supervise what they're doing, instead them doing out there whatever and getting hurt. So I would like management to think about this really and see how we can make this priority without the compromising everything else that I said, and maybe to find solutions to meet the needs of our tenants holistically. Thank you.
Tom?
Yes, through the chair.
And also, if someone maybe can talk to what are the pushback here? What are the real reasons why we cannot prioritize this? We just talked about, spending money in different ways. So why can we not see this as a priority? And some tenants say, if it's an issue for TCHC, we will work with TCHC. We will get the permit through them. We will use contractors that already pre-approved by Toronto Community Housing, so that way we're not compromising the layout of the building structure or insurance, or we're not running into slippery slow, road later on. So what is the pushback? Why this is not a priority? And I want someone to speak to that, please. And also, if this could be in the minutes, because I want this to be in the minutes. Thank you.
Tom?
Yes, through the chair to Director Farah. I guess I had the ability to be a new set of eyes on this particular matter as related to the tenants and their request. And I was, I have to say that from a being really respectful of the tenants and what they're asking, from a priority perspective and what we need to do to keep our units, our vacant units turned over for people who don't even, who are seeking housing, for the other priorities that we have, within the buildings relating to health and safety. And in particular, Director Farah, as we look, and I can speak like in the present, I can't speak, a year ago, but in the present, when we're looking at the current imperative around our budget and the challenges that we have right now, to even maintain the dollars that we have within the lines to do the preventative or demand maintenance, this doesn't percolate up to the top as one of those things that we need to address. So I certainly understand all the discussion that has been on this and don't want to in any way discredit this, and it can remain there as it, in the areas that could be enhanced, or the support for the tenants, whether it was around painting or what those are. But as it relates to some of these bigger items, I just, there's not the ability, and I'm just being really frank at this point with what we're facing, to undertake this.
But they're saying, Tom, that they will pay out of pocket, and it's a small ask now. It's just to close the ceilings. For some people, it's a health issue. Some people have asthma, some people have allergies. So just to make sure it's not so dusty when people, use this space to look after their kids for entertainment, for recreation, for, working from home. We're talking about health issues. But on the flip side, they're saying we will pay out of pocket. We will be willing to be guided by TCHC in terms of if there's a permit needed, if the money is an issue. Majority of them say we will pay out of pocket. So how much will it take to cover a ceiling and close a washer and dryer area and to paint the space? So if it's the money issue, they are willing to pay out of pocket. If it's the liability issue and the permit and making sure that we're using a properly, approved contractors by TCHC, they willing to be compliant. So my frustration is, why are we not listening to that? Why are we not willing to meet people in halfway? So we provide a holistic approach kind of service.
John?
So, yes, this has been kicked around a lot, and I had a discussion with Alan about it. And, I don't think the intention really is ever to, staff has enough to do, staff has enough priorities. I've heard this from Director Farah now for over a year. And, I think maybe sometimes we overcomplicate things. Putting up a wall as a barrier to a washing machine shouldn't require a $30,000, surety, it's going to be a hell of a wall, right? So I think it would be nice. Sorry, I have the floor. I think what would be nice is if there was some sort of very simple framework whereby somebody could come forward and make some kind of an application that could be reviewed. I think tenants just want to be listened to. They want to be able to put forward a proposal that may enhance the value of the unit. I understand that a room must have a window, and if there's no window, you can't just put up a wall. So I don't know what the answer is here. We don't have any concrete examples of people coming forward saying that this is my space, this is what I want to do. I think if we had that, it might be easier for us to respond. So I don't know if there's a simple framework that, where somebody could respond to a tenant need and then we could look at it. It makes mention of a pilot project, but you have to have a specific instance to go forward in order to have a pilot project. So Tom, I don't know, and again, I appreciate that staff has pulled in many different directions. This has been a matter of that's been raised for quite some time.
Councillor Fletcher.
Paula, did you want to speak?
I'll wait.
Just echo what John said, has been raised quite a few times, but it did start out as building rooms in the basement. And that was where we got into all of the structural issues, the building permit issues, who's building them, it's in TCHC property, et cetera. And I think that's been fully explored, and it's not really feasible. But being able to have your downstairs space as a place where the family can go and your teens can go, particularly up in areas where as it says, dangerous, you want to keep your kids inside, that to me is different than putting up a bedroom or putting up whatever. So I don't think anybody's rec room here has the washer dryer in the middle of it. So what's a cheap and cheerful solution for that? Whether we do it, whether people, I agree, they have to come ahead and say, here's a space, what can we do? If the ceiling is all open, that's another matter. It just creates a safer, better space. That is a tenant. A landlord often gives a tenant permission to do those kinds of things, paint the place, do this and that. So those are two simple things that make it a usable space for families, whereas they're not usable now, is for washing and drying and storing things. But when you have a big family and you're out there and you just don't know if your kid's going to go out the door and get shot, it's good to keep people inside. So I don't know if we can just have a little look. I'm not asking facilities to do this, kind of, who does design? Somebody just designs some little thing, cost, without going to this whole redesigning and rebuilding the whole area.
Yeah.
It's different than what we started with. We've come to a different place. We know we can't start with what we'd asked for to start with. But what can be done, cheap, like any tenant would do, or I don't know. I just think.
Yeah, through the chair to the board and to the specific comments. I'm just going to reiterate that, and I can't speak specifically to Toronto Community Housing, but when I did get into the townhouses at City Housing Hamilton, families were using unfinished basements in so many of the townhouses. We didn't put up walls for them. You know, they may have put up a screen. They did that. They made that space available. And so and I know that we talk about, you know, well, can we just put up a wall? But if we put up 40,000 walls, or once people start to request these things, and so, well, my neighbor had it, can I do it? And then when somebody in an apartment says, well, you know, I would like this wall up in my bachelor because it helps the separation, then I'm not sure where this stops and this, you know, starts. And so I am concerned about what the time would be, the staff's time and investment in this, when we are so challenged to provide even the current level that we are.
Joe?
I'm just, in reading the report specifically, I mean, I am fully supportive of the objective to support our residents in every way possible for agency in their homes and to make their homes wonderful. Now, my understanding in reading the report is that the recommendation here is to allow residents to undertake all the work that currently isn't provided for, but where no building permit is required.
Yes.
So that, like, I think, so to enable that agency to support our tenants, to reduce the bureaucratic complexity to make changes where no building permit is required, is that's what this report speaks to. The question of where a building permit is required, if it was easy to resolve that, we would have resolved it already. But it's a building permit, it's structural change. And so, you know, I'm comfortable with the report that's here, and I would ask staff that I think we should endeavor our best efforts to where building permits are required to seek to explore it, to support our tenants, to look at it. But a building permit is a big deal, and so that can't be quick. And I just reckon, and so, you know, I support the objectives set out in this report, and I would say that where building permits and structural changes are required, that is a separate process, that yes, we should look at accelerated models. But I don't think it is a structural building permit consideration, and we need to be conscious of that.
Yes. Are there any other comments on this? Oba?
Yeah, thank you. Thanks for everyone's input. I know we're trying to find a solution. I appreciate you all. It's just that a lot of people already built the basement, whether it's closing there or whether it's having divider, which is how I even come to know this, was people, there was a, what do you call it, an inspection, super went different places, people's homes, and then they were saying you have to demolish this on your expense. People were freaking out. Letters of eviction was sent and saying if that time frame, if I come back and this is not all demolished on your expense, you will face eviction, what have you. So now what do we do with the basement that are already built? And again, as I said before, like, I want what's best and doable and feasible and safe for tenants. So if we're saying just, you know, closing the ceiling and closing the dry and washer will have that much issue, then I don't know. That's what I'm gonna stop.
Okay. I think what's in the report is everything that can be done without a building permit, and it does allow for temporary barriers like screens that can be put around a washer. But and the only other comment I would make is I think all children in TCHC deserve a safe space. So can I have a motion?
My question is though, what do we do the ones that's already built?
Okay, that's a different question,
interconnected with
Uba.
this.
So can I just get, that's a different question. So can I get this report approved? Nick, seconder?
No, but
Aaron?
Adele, I didn't finish. That's a separate question. Okay, I respect that. Are we gonna do anything about it in terms of management and to think about how to improve this? Like, final.
Through the chair to Director Fair, what I would suggest in this case is that we do address it on a case-by-case basis. As it comes to the attention to our staff, that we deal it on a case-by-case. I don't think there really is anything effective, or we can be effective by making a blanket comment about kind of what we're going to do, because so often in these cases, we take it one case at a time. So that's what I would like to propose.
And I just,
But Tom, you just said it, if we do one family, it might create a problem, saying others might say, you did this for this family, so I wouldn't know where to begin and where to end. So how are we, if that's the case, if that's what you just said, how are we going to make it case by case? I don't know, I'm confused here.
So I'm sorry. So just for clarification, for those issues where tenants have already built something or put a structure in place, I think that is for the staff to assess that and to determine that what would need to be done, and they when they learn about it at the time of move out, what needs to be done. So that I need to leave it at that. I don't think we can make any broader statement.
Brian?
I think basically it comes to health and safety. So obviously, we wouldn't want any family to be compromised from a fire perspective, that if things have been done that compromise that, obviously that's our responsibility to make sure things are safe. And I agree with the report. As Tom said, we can look at the things that have been done, and as long as they don't compromise health and safety, then why change it? But if it does, then obviously we need to address it.
Okay, so can I have a seconder? Nick moved. Brian, thank you. All in favor of receiving this report? It's just for receipt. Okay, thank you. Thanks, Uba. So we will move on to item 9B, and I understand we have a deputant on 9B. Anne Marie? How do we,
You hear us?
oh, do you see her?
Yes, can you hear me?
Yep, we
Can you
can
see
hear
me?
you. You've got 5 minutes for your deputation. You can begin when you're ready.
Can everybody see me?
Nope.
No, I just,
We can hear you fine.
Anne Marie,
sorry, yes?
okay, I think I think you've turned your camera on.
Yes, I did. My preview, but I see if it's reflecting on yourselves.
Okay, we can hear you fine, so please go ahead.
Okay, so good morning, everyone, TCHC Board of Directors and everybody in the area, of course, online. West end of the city, older townhouses west end of the city, and there definitely are in need of overhaul, especially when it comes to hoods over our stoves. Most of the townhouses, we have to have fans within to remove someone's. Can I continue? Of our townhouses, we have fans in our kitchen. Some of us who can afford them have fans in our kitchen to remove the smoke that's coming into the kitchen from whatever we're cooking. So I would ask if you all can please, Board of Directors, can you please think about incorporating in the West End City of our communities. Everybody knows I'm the rep for that area. And we can please consider how we can make it feasible to have vent hoods over our stove some way, because these townhouses absolutely are about 50, 40 years old. So if there can be an inexpensive way to have this done, this would be amazing for all the tenants, you know, give new stoves, do the venting at the same time, maybe have contractors come out to the site, have a pre-look, maybe on top of the townhouses to see how they can be vented, so that we can have this possibility that is so important. I mean, it's been going on now for decades, and it's time now that we have some type of possibility in regards to venting the smoke out of our kitchens. Thank you.
Thank you. Does anyone have any comments on 9B? Any comments? for
Sorry,
the-
are we talking to the deputy, or are we talking to the item?
Either?
Okay. Oh, I have a question on the item, but not of the deputy.
Okay. So,
Okay. On the item, we discussed this at BIFAC, and I'm just wondering if you have had time to pull together some figures on the number of appliances, and, you know, we were looking at annual costs and things of that nature.
So through the chair, we do have the figures. We weren't able to get it into the board package, but if there's a specific question, Clinton Reed, Operations Compliance Manager, can answer. He does have the information with him.
Okay, so
And we can send it separately if required.
Sure. So this was for, $12 million for 3 years. In 3 years, how many appliances will we be buying? Or historically, how many appliances did we buy in the last 3-year period or in the last year period? Just curious as to what kind of information we have on how many appliances this translates to.
Thank you. Thank you for the question. And through the chair, the data that we've pulled together in regards to the amount of orders just in the west side alone, if I could probably just start off on, in 2022, we had a total of 3,312 orders. Of that, we had 1,094 were fridges and 1,284 were stoves. And that was just in 2022 alone, just for the West.
And what would the cost of those be?
The average costing of the fridges, again, it depends on the sizes from 12 cubic all the way to 23 cubic. An average pricing of that would have been about 995, I would say, for the fridges. For the stoves alone, the average price for the stoves would have been about 1,055. Would have been the average costing for those stoves. And in 2023 alone, just as of, we ordered approximately about 3,800 just on the west side alone. And of that, the fridges and the stoves, again, we were roughly around 1,100, as well as about 1,300 as appliances for stoves. In total, the orders that we've had from 2022 to now, we had about 6,700 orders that we've put through.
And what's that in dollars?
In equating that in dollars,
6,000 times 1,000. It's like 6 million.
no, I didn't have that. My apologies.
sorry, is this, I'm just wondering if this can be a takeaway, John?
My apologies. I don't have the exact dollar figure for each of those items. I can add that as supplementary to the numbers when we send that to you.
Okay, I mean, we're asked to approve like $12 million, and it's funny how it comes out, 12,094,060 60 and 20 cents. I don't know how that happens to be like that, but just wanted to, it would be great to have, what that represents in terms of actual numbers of units and average cost. So, I mean, if you could provide that at some later date, that would be fine. Is this the prices that we're paying? Those strike me as like retail prices. I mean, those. I haven't bought a fridge and a stove in a while. So, what can you tell me about the lifespan of a stove? I mean, how long are we keeping our stoves and our refrigerators? Because this is a big award. This is a lot of money. Are we replacing them on how are we replacing them? At what point?
Thank you for that question. And through the chair, maybe to address how we got to the pricing piece on that retail price piece, the negotiation that we did through the RFP process is we gave the proponents a list of the most ordered items in terms of the fridges, the model numbers, the amount of fridges, 12 cubic feet, 24, the cooking stoves, accessible units, the sizes of those cooking stoves based on previous orders throughout the year. As part of the RFP process, we opened up the pricing after we selected the proponents and gave them a list of those inventory items, and in terms of where they took that away to go and come back with prices. So they gave us both of their prices, and then we negotiated those prices in regards to if another proponent had it cheaper, we wanted that exact same price because there shouldn't be a price difference between the two if they are getting the same models in a sense. We then negotiated the price and then we went to 2 rounds of negotiating in prices, line by line, assessing each of their appliances that they've given us to make sure that they have them in stock, they meet the safety requirements that we need, they are of the right size, and they are in stock in terms of the quantity of that. Secondly, to that piece, we then took both prices after the 2 rounds of negotiation, and we created an average price for both proponents to be able to access in terms of the costing of that piece. From that point, that's when we solidified that pricing to make sure that they both agreed on that. And if they didn't have access to those appliances, they would be able to order off the list that we had originally provided. And that's how we got to the pricing piece in regards to negotiating with the proponents directly.
So the company who's receiving the award, are they a wholesaler?
There's CARE and HD Supply. And if I can speak a little bit in regards to HD Supply is in partnership with GE.
Right.
As a manufacturer, GE, the challenge that manufacturers have if they're dealing with us directly is the fact of the distribution within our portfolio is so wide. They do need that distribution pipeline to be able to distribute and deliver appliances. And our requirements, you deliver appliances and plug it in the units. And that manufacturers don't have that process. And so that's why they depend on a third party in partnership with them to be able to do the deliveries and handle those orders for us.
We would be one of the largest purchasers of appliances in Canada.
Yes.
Or the largest, is that correct? We would probably buy more than the brick, I would think. I mean,
Yes.
I don't know. That's why I was curious of the numbers that are involved here.
The HD and GE is one of the first partnerships that they've had in terms of being able to supply appliances to us. CARE is in partnership with the brick in terms of getting in those appliances, but they are just not solely with the brick. They are connected to all other manufacturers, so they give us access directly to a wide range of appliances. Our requirements are so specific in our buildings. The type of appliances that we need to make sure that the manufacturers have them. And throughout in our negotiation, we had to take off some appliances because the manufacturer couldn't guarantee that they had these and they were phasing those out, right?
Got it. So I've got your email. I'll just send, if I have specific questions, I'll just send them directly to you. Okay,
We'll definitely do, and I do apologize.
No, that's okay. No, that's okay. Thank you for the answer.
Thank you very much.
That's good.
Thank you very much. The only comment I had was at BIFAC, I just hope that we implement the tracking system so that we're tracking these, just goes back to the internal audit and process. But could I have a motion to approve item 9B? John, thank you. Joe, thank you. Seconder, all in favor? Thank you very much. We'll move on to item 9F. I pulled this. And unless anyone else has questions, my question is the timing. This is a change order that relates to a period January the 1st, 2023 to December 31st, 2023.
Thank you, Chair. It's a change order to that particular contract, not going backwards in work. It's a result of the reconciliation, and when they were doing the reconciliation, we haven't run out of funds for it, but the forecasting is that we're going to potentially need additional funds. So when it says change order January, it's because it's on that particular contract. So not the time period. I know what you're saying. We're not going back to correct an overspend.
Okay, so, yeah, my concern is that you're asking us to prove something after the fact, after the money has been spent?
It's not.
Okay, so then maybe we could clarify the way
Certainly.
it's presented. So if it's a contract dated X, the change order is for this period. So whatever you're presuming you're projecting that you're going to run out of money, and that this 1.2 million is going to be for, I don't know, January 2024 to whatever. So if we can just change the report.
Understood.
Okay, thank you. So can I have a motion to approve the change order for the maintenance, demand repairs, and the fire alarm? Nick, thank you. John, seconder, thank you. All in favor? Perfect. I will turn to item 9G. And
That's me.
Oh, that was you that pulled it?
yeah.
Okay, I knew someone. I thought it was
so-
Paula for some reason.
And apologies in the sense that I'm pretty sure we see this report every quarter. And so I've got sort of a structural question. So
Yeah.
notwithstanding, we receive this regularly. Do I understand it correctly? These items that are being listed, this report is basically highlighting the fact that they're moving from repairs and maintenance operating budget to the capital budget?
Through the chair. No, this is all strictly with capital. So within our TCHC capital plan for this year, it's 350 million. These are all changes within that overall capital budget. There's no operating to capital and back and forth.
So
all
it's still within the
strictly
same envelope, the overall envelope, it's the different envelopes within the capital budget. Just reading the item sort of struck me as more short-term in nature as it relates to, local move-outs or appliances that wouldn't necessarily be part of long-term capital. Like I'm thinking in the FCI sort of context of structural sort of major repairs to the building, where these strike me, some of these as more, day-to-day, repairs and maintenance as opposed to capital. But if I'm hearing you correctly, these were in that budget originally, but how do I sort of reconcile that? Do I have that correct, or am I misinterpreting?
Through the chair, these are in our capital plan. They are deemed to be capital. You are correct, though, that some of them can be short-term. Not everything that's paid for through our capital plan does get attributed to FCI. We do work through that internally and with our third-party provider, Amoresco, to ensure that whatever we are attributing to reducing the FCI can be quantified, verified, and authenticated that we are doing it correctly. Move-outs, as an example, that would attribute to FCI, though, because we are going in, and actually it's through a program that operations runs, where they are going in and they are improving the interior of the unit before the unit swap happens, so that would attribute to FCI. Appliances, I don't believe that contributes to FCI, but it does come from the TCHC overall capital plan, which for this year is 350 million.
Okay, yeah, that answers my main question. I wanted to just ensure that we weren't sort of going back and forth between capital and operating.
Through the chair, we're absolutely not. This is all capital.
Okay, thank you.
Thank you.
So I also had questions on this item. So the report reflects money moving into these categories. It doesn't say where the money is coming from, so it doesn't say what lines you're taking the money out of. It just says that you're putting monies into that. And there used to be a report that we would see, and it was a larger detailed chart where you actually showed the lines. And I think we need to see that so we can put it into context, as opposed to just a quarterly move. I would like to see, so you have the year to date, and your budgets, your actuals, and then what you're projecting, as opposed to just, I want to move money in. I'd like to know where it's coming from. And to Nick's point, and this is something, Nick, I'm going to ask you to look into. We have a very low threshold for our capital spend. It's only $1,500. So there is a significant amount of money that's spent that doesn't contribute to FCI, because the threshold that we deem to be capital is so low. and it's below what is recommended, and it needs to be addressed because it really is understating our what a normal landlord would consider repairs and maintenance. And that's a much bigger picture or a bigger problem, but we do have to address it because it is not, there's no positive impact on our FCI. So Nick, as chair of BIFAC,
I was going to say thank you, but instead I'll use the word acknowledged.
No, and I will go into this in much greater detail with you, because it came up with the EY report, because we are understating our operating expenses, and so it needs to be addressed, and it is threatening our ability to reach the 10%, and we do have to look at it. So.
And I could also, oh, sorry, the chart that you were referring to, Madam Chair, it is normally part of the BIFAC package, so I'll just work with governance to make sure that we put it through when it comes through.
Okay, and so I don't go to BIFAC anymore.
No,
so
understood.
I missed it then, but it just, or, if, yeah, it just needs to say.
It is the chart
Yeah.
with the envelopes
Yeah.
to show that it's going into demand, coming
out of, yeah, the to and the froms, which is,
Yes.
yeah. So could I have a motion to approve 9G? Joe, Naram, thank you very much. All in favor? And then I think the last one, we have a deputant on 11A. And I think it's Anne Marie again?
Yes, it is.
Okay.
Yeah. Just to open. It's so important that when deputants come to speak to different issues, that we need to know if our opinions are going to be put into the comments or that particular item that we're speaking to. Evictions are very important because, as we know, homes are difficult to get. Rentals are so expensive in these hard economical times, and rent that are unpaid is the way you can get evicted. Now, what is great is the fact that they have an external body that assists tenants in regards to getting help to pay their rent. That's a great body, right? I'm asking the board if they can please look at tenant complaints are serious because it triggers evictions. And also, when you have that is outstanding, that has not been addressed, it just sits there unattended, right? We should have an external body for unit inspection as well. So it's for unit inspections, it's for tenant complaints, and we can take that process away from Toronto Community Housing staff, if we can take that away from those individual persons and put it in an external body as the one you presently have now for back rent, this would be a mistake for tenants, because some tenants feel that the process that's happening right now is intimidating, it's not transparent. And additionally, if we can have a fire person inspecting and unit inspections, I take that away completely from the superintendents, right? Because they're not being done properly. I give you examples. One thing I have to do, introduce my background so I'm qualified to speak. I'm a paralegal. I have mediation. I have arbitration skills. I also have my bachelor in psychology. I'm a proud graduate from Humber College. So, and I'm a rep for West End, so I speak on these issues. Tenants are complaining. It's a serious matter that is not seriously being addressed by Roundtree office and Wilson's office, right? Now, it's very difficult when you go to meetings and people are inside the meetings with already preconceived notions before you even get to have conversations, right? Pardon? Before you even get to have a conversation in regards to the issue at hand, and individual persons who are present in the meeting are not addressing the issues that are there to be addressed, which are very serious, bullying and harassing. Additionally, they're not telling you, okay, complaint one, right, has been addressed and it's closed? No. They then tell you the process that's in place. It's a computerized generation that has to do with unit inspections. I'm one of Toronto Community Housing, long-time tenants. I've never heard of that before. Additionally, we have to make sure, because earlier I heard we're respectful of the charter, making sure that tenants' charter rights are not being violated, right? And the equality rights are being violated right now as I'm speaking with tenants that are complaining, right? That has to be looked at and addressed when it comes to these meetings that tenants are going in with general managers, supervisors, right? And this is the issue. One for instance, right? Now, if you come in and you do an inspection, and I'm going to tell you why the history is going to lead up to how I'm speaking in regards to evictions, right? If you have an orange sitting on the table for years, you never move it, you never touch it, it still stays the same place. How is that an issue if you never moved it, it never changed, and it's in that exact same spot as it was from year 1 into year 2 into year 3, right? It's absolutely impossible, right? Now, you can't have a cluttered kitchen, everybody, if 4 people can stand in a kitchen and have a conversation. That's virtually not impossible. When managers, assistant managers, if they're not cleaning out files, once your issue, complaint, whatever it is, has been resolved, right? That becomes a compacting issue in regards to your tenant file. Something happened. Can everybody still hear me?
Yep.
Oh, okay, sorry. It's something funny. So anyway, as I was saying, if we have one letter, board of directors and everybody else that's in the audience and the body for one situation, that cannot be possible. That process needs to be changed for everything. Cleaning out tenant files, because eventually they will pile up and lead to them saying, oh, we're going to evict you now because of this ongoing issue. It is unfair. Is very unfair when it comes to tenant and the process, right? So I'm asking.
Your time is up. Thank you very much.
Okay.
Okay, thank you. Are there any comments on this item? It's the OCHA report. John?
Yes, so back to the topic at hand, I just want to point out that we have Melanie Martins and Summer Nudell here from the OCH. Thank you for coming. And I don't know, well, I'll open it with a question and then let you expound on it. I noticed in the report that you were able to do direct cash payments to the board, or you were able to facilitate direct cash payments to the board of over $360,000 in the first 6 months of the year. And how many tenant files did that represent? That's on page 102 or 13 of 22 of the report. And it's 4.1 arrears managed by the OCH.
So thank you for the question. So through the chair, I have that numbers in my statistics, but I don't have it with me right now, so I can provide that to you. But it would be part of the cases where we recommended that TCHC not file for the L1 application. So I can get that number for you.
And so we're almost into November. Is the number comparable for the back half of the year in terms of files managed and funds recovered?
Thank you. So through the chair, yes, we're actually working on our 2024 work plan and looking at our results from this year, and they are comparable the 2 halves of the year.
Okay, that was all I had.
I actually had, does anyone else have any questions about this? Because I do have a question. Brian.
I'd just like to know whether these processes have been able to be incorporated into our homes project, and whether that information, because if it's all still, by the sounds of it, in paper, the process is very hard to manage. So I'd like to know, have we moved the needle in utilizing all this money we spent on homes?
Can you speak to that?
Yeah, I can. So thank you. So through the chair. So yes, so I'm happy to say that OCHA is working closely with TCHC. And historically, we've only had access to just read TCHC's information in the database, but now we're going to actually be able to use it. So not only to triage our work, so the referrals will now triage back and forth through the home system, but there's also going to be a kind of cloud developed just for OCH where we can do all of our case management on that. So it will support us a lot with our reporting and case management, creating efficiencies in the office.
And I was not so much directing it to OCH, but internally, whether we've been able to put those processes in place for, unit reviews, the processes that happen annually, has all that been able to be migrated to a technology process rather than it being a more cumbersome process.
Can
So,
someone speak to that?
Chair, we are using Homes actively to manage our tenancies. So we use it for letter generation, data management, as well as timekeeping. So we ensure that we're doing things in a timely fashion. I think working with OCH to actually get information through the system real time would be really helpful, because right now we have a bit of a parallel system. So now that OCH will be online with Homes as well, that will allow us to have the entirety of the tenancy management process managed through Homes.
so is the annual unit review incorporated into Homes then?
There's two types of annual reviews. We have the annual unit inspection that the deputant was mentioning that is incorporated in Homes, and we're able to document real-time items that we identify, which translates into potential work orders. We also have the annual review process that we are working through Homes to make sure that we have the appropriate documentation from tenants.
Great, thank you very much.
Okay. So my comments, I do appreciate that. Oh, I'm sorry, Paula.
Yes. I just wanted to get some hard fact. How many people work in the solutions team? What's the size of that?
So through the chair, we have a team of 5 complaints resolution specialists and a manager. I think there's also a clerk. And a clerk.
So 7.
Yes.
And how many intake workers are there to deal with, first of all, your rent? You're not going to start with solutions. You're going to start with our frontline staff that deal with tenants and finances and arrears.
So through the chair, we have an intake process that the clerk supports, but the complaints resolution specialists, the team of 5, are the ones that typically deal with the tenants.
But they're not dealing with their first problem. They're dealing with this once it hasn't been, not within the first 30 days. So, right?
Yes, so through the chair, the complaints resolution team deals with escalations and complaints lodged by tenants.
And when does that take on? After how many days? 30, 60 of non-payment?
Are you referring to tenancy management or in general? Because it depends on when the complaint comes in.
Arrears, the solutions, arrears.
Oh, the solutions team does not deal directly with arrears. That's the team that focuses on tenant complaints. Sometimes it could be a tenant complaining about rent calculations. Sometimes it could be a neighbor. It's a variety of issues.
So besides the OCH, who's dealing with arrears?
So through the chair, we have our tenancy management pillar led by the general managers in the regions. That team has the tenant service coordinators under them, and they're led by supervisors as well as a manager. We also have access and support community service coordinators that support that team to work with tenants on a case-by-case basis to provide them supports to maintain health of tenancies. In the last 6 months, I've instituted a centralized team, so bringing back program services that were eliminated in the last restructuring to actually provide compliance support, work with OCH, and establish training and conditions for our staff to ensure there's consistency across the region. So that team is looking to have someone in place that will do just this in terms of making sure that the tenant service coordinators are trained and provided with the effective resources to do their job. So that team is about to be up and running. We're going through a hiring process as we speak.
So you're hiring new people to do that?
We are hiring a manager that will support much of what program services historically did. So we had a centralized team that would provide training supports, resource supports, working with external bodies to ensure our frontline staff were trained. In the restructuring, that team was eliminated, and we found it to be a gap in the last year and a half. So we're working to reestablish that to ensure that our tenant service coordinators have effective training and resources to do their jobs.
And then for homes, the fact is that OACH wasn't built into the homes initially. That's what I'm hearing, for whoever wants to answer that. Nobody's here from IT, is that correct?
Not here. Was Louisa on the, okay. Okay, Louisa? You're on mute, Louisa. Not good when the IT person can't. Oh, our IT person's having IT difficulties.
Oh, still.
We can't. We can't hear you, Louisa. So. Is there anyone else who can answer that question, or? Paula, can you get that offline?
Yeah.
Because
Yeah.
Louisa's having technical difficulties.
That's fine.
Okay.
And I just would wonder, since Holmes is put in, and I'm not on your BIFAC, or how we evaluate how well it's working, where's that evaluation process built in to Holmes, Madam Chair?
We did have one update at BIFAC, and we did hear from frontline people, but that was early on when the project was just finishing up. So I don't know if BIFAC is planning on doing that again, but Nick, I don't.
Through the chair, I believe
Like to
that,
hear, what
sorry.
was the cost of that project?
through the chair, I can,
It was 54 million.
So I'd like actually the board to know that, not just a committee. I think that our board needs
No,
to be.
yeah, it would, yeah, and it can come up through BIFAC to the board.
All right.
Okay.
Chair, I believe there is an outstanding action item at BIFAC to report back on.
Can't hear you, Darren.
Okay.
Chair, I believe there is an outstanding action item on the BIFAC agenda to report back on the benefits of the homes program from a dollars and cents perspective.
Yeah.
Just looking for an evaluation, and might not be a self-evaluation. So I'd like the chair to make sure that everything's on track with the $54 million program,
Okay,
please.
so we can make that an action item for the board. Uba?
Thank you. I just want to know, in terms of time frame, how long does it take the referrals from these 2 months? Is it 6 months? Is it a year? What is the time frame?
Thank you. So through the chair, so on average right now, when we look at page 11, we talk about the top 3 arrears collection process findings. And what we're finding is on average, we're getting the file when the tenant's in 7 to 8 months of arrears. Oh, sorry, 7 to 8 months in arrears. That being said, there has been a backlog given that there was a moratorium on evictions and all of the things that happened through COVID. So while we still track the timing, we're not holding TCHC accountable for some of those cases because they had no opportunity, they could not move forward. Once they were able to, they've now sent those through. So that's why we are kind of talking about those cases in here that we want to review with the large balances, because these were tenants where no one could move forward, and we recognize that it wasn't just TCHC's fault because they couldn't move forward with them. So now we're going to look at how to deal with those large arrears balance cases.
Okay. Uba, does that answer your question?
Yeah. It's getting better, I think. At one point, a couple of years ago, it was like 16 months. So I'm glad to see now the time is reduced, and thanks to the staff.
Okay.
So that answers my question. Thanks.
Thanks, Uba. Are there any other questions? I just had one quick one. So I do appreciate the change in the format of the report. I've always had concerns about the reports in the past because it seemed to be a focus on highlighting the number of errors. And I think that can be very demoralizing for TSCs. And I don't think that that's a good way to affect positive change. And I think arrears is very important for TCHC. So I've been hearing about this OACH approach as long as I've been here. And I would like the board to hear from TSCs, how this is working and how it's impacting their daily work, because they're doing the lion's share of the arrears collections. And I know that there's been changes in the, what do you call it, the ACP? So I'd like to see, I would like the board to hear from the TSCs to see how this is working and how it's benefiting. I'm hoping it's a benefit to their work processes, but if it's not, I think the board should know that as well. So I'm going to ask Nadia, and I don't know who would, represent the TSCs, but I would like someone to come to the next. So when you're presenting the next quarterly report, I would like somebody from I don't know, you might have this manager or whoever you've got in place by that point, but I would like a TSC to come to the board and speak as how it's working within the organization. So if we can put that on the list, and that was my comment. So thank you very much. So Paula?
Yeah, I'm just going to speak, and I'm sorry that I got mixed up, because I really recall that when the solutions team got put in place, it was to be, in my mind, or as far as a board member understanding, that what the TSCs couldn't resolve, there be another attempt by solutions team prior to it going to the OACH rather than directly. But you didn't tell me that. Former COO told me that. So that was explained to us at the board, that the solutions team is here. They're going to assist in that. So it's very helpful to understand that that didn't happen. Or that isn't the way it works. I would like to understand better about homes, and I think our chair's agreeing to that. But I also just want to talk about evictions, and we heard from the deputant. I do deal with a lot of tenancy matters in my role, and private tenancy matters. And there's a lot going on out there in the private property world, private landlord world, and Tom, you probably know this, around tenants. They're being evicted, they are being rent-evicted, they are being dem-evicted, they are having the rent raised, they are at the landlord and tenant board for 10 or 13% raises. I think we need to really understand that for all the things that go wrong or seem to go wrong at TCHC for tenants, what goes right is the security of tenancy is very strong. It takes a lot to get kicked out. And it takes a lot to get kicked out for arrears because we want our tenants to be successful. So whenever we hear about, I know some of the taps don't work and I know all of these things, but the fact is everybody has a roof, everybody can make a call, everybody can come to the board. Tenants in private landlord situations rarely have any of that. So that should be our perspective, given what's going on in landlord-tenant relations out there in the real world. Not that we're not in the real world, but in the tenants who are in with private landlords.
Thank you, Paula. It's important. Are there any other comments on this item? Okay, hearing none, can I have a motion to receive the OACH quarterly report? John, Nick, seconder. Thank you. All in favor? So if there's no other business, could I have a motion to terminate? Pardon? To adjourn, not terminate. Motion to adjourn. Okay, sorry. On some occasions, I would like to terminate. Okay, John, Nick, seconder, all in favor. Thank you very much. I hope everybody has a good day.